Hello and welcome to today's webinar, Pulling Back the Curtain, the How, When, and Why of Intensive Residential Treatment for OCD and Related Disorders, featuring Dr. Nathaniel Van Kirk. I would like to now introduce Dr. Van Kirk. Dr. Van Kirk is a licensed clinical psychologist specializing in the conceptualization and treatment of severe anxiety disorders, obsessive compulsive disorder, and trauma PTSD. Currently, Dr. Van Kirk serves as the coordinator of inpatient group therapy for McLean Hospital, Harvard Medical School, as well as the coordinator of clinical assessment at McLean Hospital's OCD Institute. He received his doctoral degree in clinical psychology from Virginia Tech. Prior to accepting a postdoctoral fellowship at the OCDI in 2015, he completed his pre-doctoral internship at the Michael E. DeBakey Veterans Affairs Medical Center, where he received training in severe mental illness, PTSD trauma, and substance abuse disorders. There will now be a brief moment of silence while I transition the presenter role to Dr. Van Kirk.
Thank you very much for that introduction, and thank you to ADAA for letting me come talk a little bit about intensive and residential treatment for OCD and OC-related disorders. So today, my goal is really to just kind of go over a little bit on what OCD treatment looks like in an intensive format. And just to set the stage, we do know that OCD is a really impactful and really powerful kind of experience that people will go through that can really have a really negative impact on their day-to-day life, their functioning. But the great news is that we have really effective treatments. And as many of you who are watching probably already know, that exposure and response prevention is kind of the gold standard for treatment for OCD and really at the foundation of treatment. The great thing is that research has shown over the years that ERP and cognitive behavioral therapy for OCD is incredibly effective. However, it's also important to note that there are sometimes challenges where some individuals who maybe have complex comorbidities or other medical comorbidities still struggle following treatment or may have to go through multiple rounds of treatment. Many do remain symptomatic, and there are a subset of individuals who may have limited treatment response or may drop out of treatment and may need a little bit more support as they're going through the treatment process. And really, it's those moments where intensive residential treatment can really come into play. And so my hope today is to talk a little bit about intensive residential treatment and remove some of the mystery on what it is that we're actually doing and what to expect when you're working with clients who might be transitioning into intensive and residential treatment, which I'll be calling IRT as we go through this. But just to kind of talk a little bit about what options are out there, is we really do have multiple levels of treatment options available. The most kind of typical one that we would talk about is the outpatient level. And this is kind of what many of us would do 1 to 2 times a week with an individual, and where a lot of the research on OCD treatment outcome kind of sits. However, for those that might need a little bit more intensive treatment, there are a lot of different options, including intensive outpatient settings. And this can be either in an individual 1-to-1 format, or it can be in a combination of individual and groups, and usually runs for 2 to 3 hours a day. It gives a great option to increase the dosage of exposures and treatment, but still allow people to kind of remain engaged in their day-to-day. Above that, you might find something called a day treatment program. So day treatment programs are a little bit longer, usually 4 to 6 hours a day. They're usually a combination of group and individual programming, and really kind of focus on both giving core and base skills, such as emotion regulation or mindfulness, in addition to kind of focused exposure and response prevention or CBT interventions for OCD and related disorders. Many have also probably heard of the next level, which is called the partial hospital program. Now, at first glance, a partial hospital program really looks very similar to a day treatment program. The main difference being that while it still lasts for about 6 to 8 hours a day, there is the addition typically of a nursing or medical staff on site. It allows for a focus on more complex medical cases. If there needs to be more medication management or observation, that's also something that's possible. Additionally, at this level of care, you can sometimes integrate things like neurotherapeutics, which I'll talk a little bit more as we go through. Beyond that, we have the residential treatment programs. And so the day-to-day of a residential treatment looks very similar to a partial hospital or day program, just with the addition that the individuals will stay there overnight and they have 24-hour staffing. So at the OCD Institute, we have 24-hour coaching, and really what we focus on is how to help individuals maybe have symptoms that interfere with their morning or evening routines, or really kind of get in the way of the day-to-day functioning in between exposure sessions or groups, and provide that support on a 24-hour basis. Now, looking across the levels of care, there's also the inpatient level of care. And now this is usually more of a stabilization and a shorter length of stay. There are some inpatient units that may collaborate with OCD specialty programs and provide a starting point for OCD or OC-related treatments. A lot of times individuals may go to an inpatient setting and then transition down to a residential or partial hospital program to get more specialized treatment for OCD and related disorders. Now, while this year, 2020, has turned out to be something more out of a Stephen King novel than necessarily the things that we were hoping for or maybe wished for on the first of the year, there have been some very exciting and important developments in the different care and the way that as a mental health field, we've adapted to the need and to this unexpected situation. And one of those things that I think is really important to highlight is that we also have a new level of care. At the OCD Institute here in Massachusetts, and also the Houston OCD program in Texas, along with many of our colleagues across the country, have all been diligently working to increase a virtual partial program or virtual levels of care to make more specialized care accessible to everyone, no matter where they are or whether or not they can access the partial hospital program or residential program at this time. And I'm going to talk a little bit more about this virtual partial program as we go through today, because I think it gives a really unique opportunity for individuals to get kind of tailored treatment in their day-to-day settings. For many individuals who maybe have certain rituals that only take place in their home or in their apartments, this is a great opportunity to use telehealth and to use some of the technology that we have at our disposal to give tailored and individualized treatment within their day-to-day life. And so to start, I want to talk a little bit about who we see as seeking intensive and residential treatment. Generally speaking, the majority of the individuals who seek intensive residential treatment, and this is specific for OCD and OC spectrum disorders, do have a primary diagnosis of OCD. And we see that their OCD symptoms tend to have a mean of around 24.61, which is right on the verge of the severe range of the spectrum based on the Y box. One of the things that's also important to note is that about 30 to 35% of those individuals who seek treatment and have a diagnosis of OCD also have a comorbid diagnosis of another OC spectrum disorder, such as hoarding, body dysmorphic disorder, trichotillomania, or excoriation disorder. However, in addition to that, we also have a high rate of comorbidity in those that are seeking intensive residential treatment. About 85% of those that have come through treatment in the last couple of years had at least one comorbid clinical diagnosis. The most common ones that we saw were major depressive disorder and pervasive depressive disorder. Additionally, we saw a number of people had social anxiety disorder or generalized anxiety disorder. And then remaining 35% had a variety of different clinical diagnoses. In addition to this, about 35% of individuals that seek treatment at a residential level of care also would meet diagnostic criteria for characterological or personality diagnosis. And all of this is based on structured clinical interviews that we do at intake. And really, I present this just to say that intensive residential treatment is a great option to provide hope and a treatment setting for individuals, even if they have complex comorbidities. And while we focus on OCD, and we're really focused on helping address OCD symptoms, just because somebody is struggling with a comorbid disorder doesn't mean they still can't utilize and leverage those strategies and skills while treating their OCD symptoms. However, a caveat to that is we do specialize on OCD treatment, and for many intensive residential treatment settings, it's important to make sure that individuals have a set of skills to address their comorbidities as they come in, so that we can help support them as they're seeking treatment for their OCD and OC-related symptoms. To give a little bit more of a context of kind of who's seeking intensive residential treatment right now, we do see that about 72% of those that seek treatment have had previous exposure and response prevention or CBT-based treatment targeting OCD. For those individuals, they may have had multiple years of treatment courses or medication trials. And really what they're identifying is that they just need a little bit more intensity and duration to their treatment, a little bit more support as they go through their exposures, especially those higher level exposures. Our mean age currently has been about 29 years old, and that fluctuates a little bit year by year, but it runs the spectrum across all age ranges. There are intensive and residential services for all age ranges and all severity of OCD and OCD-related symptoms. Additionally, we see that about 53% of those that are seeking treatment tend to be unemployed, primarily due to the interference that their OCD symptoms have caused in their day-to-day life. And our general length of stay is about 56.4 days, which is about 8 weeks. And this is pretty commensurate with what I've heard from other colleagues who work in residential programs across the country and across the world. And as a whole, that kind of fluctuates a little bit here and there, but that doesn't mean that people have to stay for 56 days or 60 days or 8 weeks. We have individuals who may come in really motivated, they know what they want to work on, they have certain goals they really want to achieve, and they might come in for 3 or 4 weeks, feel like they got the skills and strategies they need and feel confident to transition back to outpatient therapy and continue with their day-to-day life. For others, they may feel they need that added support for a longer period of time. The great thing about intensive residential treatment is that it can be flexible and tailored to the individual. So what I'd like to kind of focus on today is talking about preparing for intensive residential treatment. If you are working with somebody who's considering intensive residential treatment, or trying to figure out if this step is right for them, there are some important considerations to discuss with them and their family members, loved ones, significant others, as you consider what option and what level of care might be the best fit. A few questions that are important to consider when discussing what level of care to enter into is, there are times when a higher level of care may be beneficial, such as if stepping away from day-to-day life would allow for a greater focus on treatment. Sometimes day-to-day life can become really hectic and it can be hard to really carve out the time to truly engage in the length and extent of exposures that would be most beneficial. There are also times that for individuals, OCD symptoms are interfering with their ability to do daily self-care tasks, such as efficiently take a shower or eat or feed themselves, or maybe take care of their day-to-day, such as medication management or otherwise. These are all times when an intensive level of care can be very, very beneficial for an individual. Additionally, there may be times where someone is moving through their treatment and really they start to struggle with independent exposure practices. We talk with many people who do really well when having coached exposures, but really struggle to transition that to an individualized, self-directed exposure process. One of the great things about intensive and residential treatment is that we have the opportunity to do both coached, therapist-assisted, and self-directed exposures, and can really help support individuals as they build the confidence to do those independent exposure practices. Sometimes it may actually be due to the comorbidity or the impact that comorbid symptoms have on an individual's treatment. And so if there's a complex medical picture or a complex comorbid clinical picture, sometimes a greater level of support may be helpful as they go through their treatment and recovery process. Now, I also though wanted to highlight there are other instances where an intensive level of care may be beneficial, and it might not just be due to the severity of one's symptoms. Unfortunately, there's still areas across the country and across the world where they really lack the local services or specialized treatment for things like OCD or OC spectrum disorders. And while this has really changed drastically over the last few years, there are still individuals who may struggle to get the treatment that's most effective for them. Or we have individuals who may really want to maximize their treatment gains in a short amount of time, such as students who are on break from school. These are also times where intensive levels of care can be really helpful, really beneficial, and really powerful in helping someone kind of get back to the day-to-day life and living a life that's most important to them. Whenever you're preparing for intensive residential treatment, I think it's important to really discuss what some of the common concerns are, and that identify there are some misconceptions about intensive and residential treatment. And I just want to take a moment to discuss those here so that it's something that individuals can discuss with their clients ahead of time. Some of the concerns that I hear the most when talking to people about intensive levels of care is individuals or clients may ask, will I be forced to do exposures I don't feel ready for? There's this feeling that by entering and choosing to enter an intensive level of care, essentially their ability to choose will be taken away from them. But honestly, most intensive and residential treatments are voluntary programs. The goal is to help support someone so they can choose to engage in their exposures and choose to utilize these skills in their day-to-day life. And so we never force anyone to do exposures. We'll talk through what are some of the challenges that they might be facing in doing those exposures. We also don't use hands-on coaching. All coaching is verbal prompts. So ultimately it's up to the individual to decide, is this something that I'm ready to do or willing to do? Or in some cases, maybe I should go back to my day-to-day life, practice a few things, and then come back when I'm ready to address some of these more difficult symptoms. Another concern that many will say is, what if I experience an anxiety level that is higher than what I can tolerate? I think this is a really common concern, just as with exposure in general. For many, the idea of tolerating that anxiety can be incredibly overwhelming. One of the things that we focus on is not so much trying to get away from that anxiety, but how can you learn that you're actually able to tolerate a lot more anxiety than you actually believe that you might be able to? And how do we help support people as they develop that sense of confidence? One of the other things that comes up is this feeling that going to intensive residential treatment is only a last resort. And some might be afraid to attend residential treatment, thinking that if it doesn't work, then there's nothing left for me. And I really think that this is a powerful concern, but also a little bit of a misconception about what intensive residential treatment is. Intensive residential treatment really is just a stepping stone in helping someone develop the skills and providing the support that they need to engage in exposure and response prevention or other specialized treatments for the symptoms that they're struggling with. By no means is it a one-shot deal or a last resort. It's a stepping stone on a recovery path. Kind of in those lines, some of the misconceptions we hear a lot is that intensive residential treatment is the fix or the end of treatment for someone, thinking that if I can just make it to intensive residential treatment, that'll be the end of my anxiety, my OCD, my struggles, and that this will fix everything. Or that then intensive residential treatment exposures are somewhat different than what you might see in outpatient therapy, or might feel somehow less overwhelming. However, I think it's really important to really discuss these misconceptions with individuals when they're considering intensive residential treatment, because really intensive residential treatment is, as I've said before, just a stepping stone. It's not the end of treatment or the fix, but it is a place to get intensive practice on how to use these skills in day-to-day life so that you can transition that back to your outpatient treatment team and the things that you want to be doing in your day-to-day. And additionally, as I'll discuss shortly, really intensive residential treatment is based on traditional exposure and response prevention, just a slightly higher dosage of it. The final misconception and concern that I hear from many is, if I choose to come to intensive residential treatment, will that mean that I'm going to be locked up, that I won't be able to choose to leave when I want to? And I really want to reinforce the importance that intensive and residential treatment is a voluntary treatment for OCD. You know, anyone who comes, I can speak for us at the OCDI, and I know this is similar across all of the specialized treatment programs, is that we're really looking for individuals to choose to want to take that step. Just because you choose to come to intensive residential treatment does not mean that you will be locked up. Our goal is this to be a place where you're taking ownership of your treatment and helping work with your treatment team to determine what the next steps are, what the length of stay is, what's the best treatment path for you. And so as we set the stage for treatment, one of the things that I tend to do when I'm working with individuals who are thinking about attending intensive residential treatment is make sure that each person really has a sound understanding of ERP and treatment. How does it work? Why does it work? What are the traditional approaches, such as the habituation model, but also a focus on understanding the inhibitory learning model. One of the reasons why I really think that this is important is that truly understanding the rationale behind treatment really can help increase buy-in. It can help increase willingness to engage in difficult exposures. But probably the most important piece is that it does help set appropriate expectations about the treatment experience. That treatment and intensive residential treatment, just like all exposure and response prevention and treatment for OCD, isn't necessarily about getting rid of any feelings of anxiety or getting rid of thoughts that are causing distress, but learning how to cope with them. Learning that anxiety is a part of life and helping to set kind of realistic goals and expectations for treatment. As someone's considering intensive residential treatment, setting these realistic goals and expectations is incredibly important. And I also think it's incredibly important to have that discussion, not with just the individual that you're working with, but also their family members, their loved ones, their support network, those that they want involved in the treatment process. In preparing for this talk, I reached out to many of my colleagues who work in intensive residential treatment just to get their thoughts on what are the biggest challenges that you've noticed you run across or individuals struggle with when they transition into intensive residential treatment. And what are the things that you found to be the most helpful? And one common theme that continues to reoccur is helping clients to set realistic expectations for treatment prior to entering intensive residential treatment. And as we'll discuss shortly, family therapy is a really important part of intensive residential treatment for OCD. And so helping the family members kind of set expectations for what treatment's going to look like, how long it might take, but also what is life after intensive residential treatment going to look like are really important steps. And this can include things like discussing structure and starting to develop some structure in individuals' day-to-day life. Trying to discuss what would structure after intensive residential treatment look like, because getting a jump start on that can really make the transition both into treatment and out of treatment much easier. It can also help with things like adjusting sleep schedules. One of my colleagues, Dr. Jacob Noda, and his colleagues in Meredith Cole's lab and many others are doing some amazing work on helping us understand the impact that sleep actually has on OCD symptom severity and treatment process. One of the struggles that we see many kind of come into intensive residential treatment with is when they're on a reverse sleep schedule. A lot of times OCD can start to take up so many hours with their rituals that the sleep schedule tends to get pushed back further and further and further. The more isolated someone becomes, the more challenges they may have with sleep hygiene or falling asleep kind of in normal hours. And we are kind of seeing that those that come into treatment with a reverse sleep schedule really have a very difficult first couple of weeks as they try to reacclimate to a normal sleep schedule. And it can be difficult to engage in things like 8:30 in the morning groups or morning ERPs. And so helping patients set up structure and sleep schedules, I think, are really important steps towards preparing someone for intensive residential treatment. The other piece of that we found to be really helpful in helping someone prepare someone for intensive residential treatment is reinforcing distress tolerance and emotional regulation skills, helping people identify their primary coping strategies so they feel like they have something to fall back on should something catch them off guard or should they have an unexpected ERP. In addition to that, helping them reach out for help. A lot of times it can be very challenging, very stigmatizing, very embarrassing to reach out for help when you first start intensive residential treatment. Knowing that there's staff around 24/7, the feeling of being watched can be a very scary experience. And so helping set expectations and helping people feel confident in their ability to reach out for help are really important aspects of setting the stage for a successful intensive residential treatment stay. One of the other things that I really wanted to highlight when it comes to helping someone get ready to start intensive and residential treatment is there can be this moment where treatment feels like it can almost stall out a little bit. And as you start having that discussion with your clients about is a higher level of care necessary at this point, it can be easy to fall into this aspect of getting ready to start and prepping for intensive residential treatment. And sometimes we see individuals try to pause OCD. So clients may say, well, can we just pause my exposures until I get to residential treatment? Like I'll pick it back up once I get there. However, I really think that this is a really challenging setup for someone to transition into intensive and residential treatment because preparing for intensive residential treatment is not necessarily the same as pausing ERP, given that intensive residential treatment is actually based on intensive exposure response prevention. So that practice is incredibly important. And so continuing to practice exposures, even if they're not going as well as someone would like, prior to intensive residential treatment, but continuing to practice those skills and try and kind of move towards those things that are challenging, even if you're repeating previous exposures, is a really important part of maximizing someone's experience in intensive residential treatment and helping prepare them for the challenges that they may face as they transition into such a program. And so to kind of reinforce why that's so important, I wanted to give a little bit of a sense of what are the different elements that someone might come across during intensive and residential treatment. Now, a lot of times it kind of feels like when someone's first looking at the schedule or talking to someone who's in treatment, it may feel like we throw a little bit of everything at somebody. And in many ways, there's a lot of different paths through intensive and residential treatment, and it can feel a little bit overwhelming from the outside to try to figure out, like, what is this actually going to look like? But ultimately, all of it is based on intensive exposure and response prevention. For example, if someone's going through a treatment day at the OCDI, they'll typically be involved in 2 to 4 hours of planned ERP, both therapist assisted, coached, and self-directed. And that's in addition to things like morning exposures, if someone has morning or evening rituals or symptoms, meal coaching, when these symptoms may revolve around meal times or eating. And so you can very quickly get to 6 or more hours of ERP per day. And so I think it's important for people to know that you kind of hit the ground running when you jump in, and having a good sense of what it is that you want to achieve and where you struggle and where you feel confident in your exposures can really help that ease that transition. In addition to that, there's individual therapy, where 2 to 3 times a week, individuals will meet with a behavior therapist. Also, family therapy is a really crucial component to it. Things like how to address accommodation, how to think about structure, how to reduce things like reassurance, but also how to help individuals and family members and loved ones kind of relearn how to connect with each other, how to discuss, how to be together without OCD kind of structuring that for them, without that being the central focus, but allowing the individual to get back to day-to-day family life. In addition to that, intensive residential treatment does include a significant component of group therapy in addition to these individual and exposure meetings. To give a little bit of an example, we have some standard groups that we give, including cognitive therapy, emotion regulation, a motivation group, relapse prevention, skills like mindfulness, and then also how to deal with things like guilt and obsessional guilt. But in order to tailor the treatment experience to the individual, we also have a number of symptom-specific groups that people may engage in. For example, we have hoarding groups or habit reversal if someone's struggling with other OC spectrum disorders. For those with social anxiety, we have a social anxiety group. There's also a BDD group for those with bi-dysmorphic disorder. One that I think is a really powerful group can be the bathroom habits group. One of the things that is true as we age is that it's really harder and harder to get a sense of what is quote unquote normal bathroom behavior. There isn't really a great time that tends to present itself to really have a discussion with friends or family about what do your bathroom habits look like? Not really something that's easy to bring up at dinner. And so for many, they'll come into treatment and say, I really don't know what a normal bathroom routine looks like. And I'm not sure I really want to ask somebody. So these symptom-specific groups provide a safe place for individuals to ask the questions that maybe they've had for years and didn't know how to ask, to connect with others and reduce the stigma around the questions that many of us have, whether or not we have OCD, and to really learn how do I go about my day-to-day life? What's my next step? What kind of things should I be working towards? And so when you take all of these together, it really allows for a pretty individualized and tailored treatment experience. In addition to that, we do also have medication management as a core component of it. And now this could include weekly meetings with a psychiatrist. It could include medication changes to better target the OCD symptoms. In addition, medication management may include things like getting consults from other areas of the hospital for comorbid symptoms. So if someone's really struggling with comorbid major depressive disorder, we may include things like ECT. TMS may also be integrated into the treatment protocol. And so there's a lot of different options that come along with intensive residential treatment to help tailor it to an individual. But with that also comes a pretty intensive day. So what a daily schedule might be is starting at 8:30, we typically have a treatment planning group where individuals meet together with the counselors and really set their goals for the day. Think through, what is it that I want to accomplish today? What are the things I'm worried about? What kind of things can I do to kind of take that next step in my recovery? Then at 9 a.m., the first group of the day, followed by 2 hours of ERP, lunch, and in the afternoon, another 2 hours of ERP, and interspersed in there may be symptom-specific groups for their kind of individualized symptoms that they're struggling with. In the afternoon, we might have more both kind of mindfulness groups for everyone, along with symptom-specific groups such as the intrusive thoughts group. But ultimately, as they go throughout the day, it all kind of comes together in the evening where everyone meets back up and kind of goes over a self-assessment for the day. What was it that they learned throughout the day? What did they accomplish? How did their progress towards their goals go? and what kind of things do they really want to focus on the next day. One of the other really great elements of intensive and residential treatment is that we also have the opportunity to do things like leisure skill outings. Not so much right now with everything going on, but we do get to do things like maintaining health. And prior to the COVID-19 pandemic, we would do things like having people go out to dinner or go to the mall or go out and about around the surrounding area to practice the skills they've learned throughout the day in a day-to-day setting to help generalize those skills. This is an example of what our virtual program looks like. And while a little less, not quite as intensive for the day, the virtual program still runs from 8:30 to about 3:15 or 4 o'clock, depending on the last meeting of the day, and follows a fairly similar structured schedule that includes a really big focus on exposure and response prevention throughout the day. So really, in kind of providing that information, I think it's important to go through these potential schedules with clients when they're considering residential treatment, to really discuss how ready do they feel for that type of day-to-day structure or commitment. Are there things that they'd like to work on ahead of time, or things that they think would be helpful in preparing them for that? Partially because we really do hit the ground running. Once you admit into an intensive residential treatment setting, really from that first day, the expectation is engaging in groups and engaging with your treatment team, and it can be really exhausting experience and anxiety-provoking experience. And we always think it's important for people to understand that it's a commitment to come in, but it can be a really powerful moment of change in your recovery process. And so for the remainder of today, I'd really like to focus on what are some things that can help individuals maximize their treatment gains. Some important considerations when someone is engaged in intensive residential treatment is that there is a difference between doing ERP and truly engaging in ERP. One of the things that we sometimes run across, and that can be a challenge, is when delegating responsibility for doing ERP, it can sometimes reduce the impact and how closely someone connects with the negative anxiety-provoking feelings. In a way, when you struggle with OCD, you have an ability to kind of keep those at bay a little bit. And so there really is a difference between just doing the ERPs because someone told you to, versus being an active participant and taking ownership as part of the treatment team, and having a willingness to lean in and experience and tolerate anxiety and other emotions instead of trying to get rid of them. And so when we talk about engaging in ERP, really kind of setting an expectation that leaning in and experiencing anxiety and other negative emotions is a part of human life, and it is something that you're capable of tolerating, even when it's really, really uncomfortable. And so as part of that, I think one of the biggest things I try to reinforce with everyone that I work with is that when you're engaged in any treatment, you are an integral part of the treatment team. And taking responsibility for your own treatment is incredibly important. It can make the difference in how quickly you see results. It can also make the difference in how confident you feel, even when things don't quite go as planned. Remembering that treatment isn't a passive process, but requires active participation and engagement. Sometimes people will come in and feel like, I'm just waiting for this to work. If I can just wait for this, I'll feel a little bit better and then I can engage. But unfortunately, as one of my colleagues pointed out, if you're waiting for it to happen, you'll be waiting forever. But if you really say, even if I feel overwhelmed, even if I feel anxious and feel like I don't know what to do, I'm going to take that next step forward. That step is one step closer to getting through that anxiety and learning how to kind of tolerate that and cope with your day-to-day and do the things that are most important to you. And that really brings up this idea that I think is central to all treatment, which is motivation. Motivation is one of those things that we have a tendency to talk about a lot, but very rarely do we actually sit down and think about what motivation is. What does it feel like? How do I define it for myself? But it's something that gets tossed around a lot. Because once I just have to figure out how to get motivated to do X, Y, or Z, and then everything will fall into place. So one of the things that we try to do in preparing people for intensive residential treatment is help them connect with their values and what is the most important thing for them to accomplish while they're in treatment. Knowing that this is one step in their treatment journey, and what are the things that they really want to focus on while they're in an intensive level of care. One of the questions that I tend to ask people a lot is, what makes it worth it to take the risk of not ritualizing? And sometimes the answer is hard for them to come up with. And so I think discussing that with people and really nailing down what is it that motivates you, what is it that drives you to take those risks and to take those difficult steps can be something that you can fall back on when treatment gets difficult, and can really make the difference in how efficient intensive residential treatment can be. We find it helpful to specify what changes specifically a person wants to make during treatment. The idea of kind of pausing life until I get better can kind of be a never-ending cycle. And so really kind of focusing on the function. What are the things that you really want to functionally be able to do in a day-to-day? What things would make your day-to-day more enjoyable, more value-driven, and would make your day-to-day worth the risk and worth the anxiety? Detailing those specific goals can be very helpful in setting someone up for success for treatment and beyond as they transition out of intensive or residential treatment. One of the other things that we found is that in addition to treatment, there's a little bit slightly separate aspect that we consider willingness. And in some of our research here at the OCDI, we actually found that willingness to fully experience unpleasant and unwanted thoughts, emotions, and bodily sensations versus trying to get rid of them actually was related to better treatment outcome and greater reductions in OCD symptoms week to week, above and beyond that which was accounted for by initial severity and many other factors. This seemed to be a really crucial factor in how well someone responds to intensive and residential treatment and how efficiently that progress moves forward. So the higher one's willingness to tolerate and accept and experience those unpleasant and unwanted emotions, the faster they're going to see symptom reduction and the faster they're going to be able to get back to their day-to-day life. And I think that's a really important thing to reinforce with anyone who's thinking about intensive residential treatment, is that that willingness to fully experience unpleasant thoughts, feelings, and emotions is really a core component of what we mean by engaging in ERP, and is really a core skill for all of us as we move through our day-to-day lives. To give another example of this, is we found when we look across treatment that the longer someone stays in treatment, we actually do see that their motivation or their reasons, internalized reasons for engaging in treatment-related behaviors does tend to increase pretty significantly. One of the things that we found in one of our past studies, though, was that really around week 3 to 4 is when we see the greatest increase in internally driven motivation. That also tended to dovetail with when we saw significant drops in an individual's OCD symptoms. And so one of the things that I think can be really important in helping anyone who's interested in intensive residential treatment really get the most out of treatment and maximize their gains is helping reinforce this idea of motivation and willingness early on, so that they can kind of hit the ground running and really make use of those first couple weeks that they're in intensive treatment. And so with all that, I did kind of want to wrap up a little bit and just give a message of hope. Is that while intensive residential treatment is incredibly challenging, it can feel overwhelming at times, and it is very demanding, it's also incredibly effective, even for those with the most severe symptoms and complex comorbidities. When we look across all the data that we've gathered here at the OCDI, and in talking with colleagues from residential treatment facilities across the country, we're seeing significant drops in overall symptom severity and across all the different docs dimensions of OCD symptoms. One of our longitudinal studies looking at OCD symptoms week to week did find that amount of time in intensive residential treatment was significantly associated with ongoing reductions in OCD symptoms. And so that's always a great thing to see, is that the things that we're doing, the hard work that our clients are putting in, is truly paying off. It's allowing them to get back to living their day-to-day life and to feel some confidence in their ability to transition back home. And that's a really rewarding and a really exciting thing to see. And so with that, I just wanted to share a few final thoughts that some of my colleagues had passed along to me, and really I thought were important when we think about the process of intensive residential treatment. Some of the things that my colleagues have mentioned is remembering that intensive residential treatment isn't a cure or a fix. Really, it's intensive practice. The goal is living a life that one values, and that it's important to set realistic kind of treatment goals and expectations around this aspect for individuals and their family members, so that everyone can feel like they're supporting each other and on the same page as they move forward with intensive treatment. Another great recommendation is helping clients put together a trigger box prior to coming into intensive residential treatment. We're gathering all those exposure items, that even the ones that they feel like, I I'm not ready for this. I'm not ready for these exposures. Just the act of gathering them together and putting them together really helps set those expectations that treatment will move in that direction, and that you'll get to a point where you can face and you can overcome those most difficult OCD symptoms. And no matter what your OCD throws at you, you can do those exposures and move through them. Because ultimately, anxiety is inevitable. It's part of being human. It's part of the human experience. It's something that all of us are experiencing right now. The question that usually comes up is, why is it worth it to move through the pain that OCD can cause? Because ultimately, recovery is an ongoing journey. It's an individualized journey. It's not, and IRT is just one step in that journey. It's not necessarily the endpoint. When I frame intensive residential treatment, I really try to frame the fact that IRT is about building confidence and skills that will help you in all aspects of your life moving forward, so that individuals get to a point where they feel like, it's okay, I can do this. No matter what happens, I've got this, and I can take that next step in my life and do what's most important to me. And so with that, I just want to say a big thank you to all my colleagues at the OCD Institute and everyone who helped out with giving their thoughts and considerations to pass along today. I also want to give a big thank you to ADAA for letting me come and give this discussion about intensive residential treatment. And so with that, please, if you have questions, feel free to reach out. And I hope everyone does well and continues to stay motivated forward and stay safe and healthy. Thank you all.
Thank you very much, Dr. Van Kirk.
My pleasure.
If you are not yet an ADAA member, we invite you to view the many membership benefits that ADAA has to offer. ADAA members enjoy year-long access to continuing education programs, free access to special interest groups, including online peer consultation groups, promotion of your practice in ADAA's online Find a Therapist database, significant discounts to ADAA's annual conference, and much more. We would also like to invite you to check out more ADAA on-demand webinars by visiting our website, www.adaa.org. On behalf of ADAA and our presenter, we thank you for joining us today.